Good evening, everyone.
Good evening.
So good to see all of you out tonight. My name is Precious Green. I'm the Director of Programming here at Manny's. Welcome. We are so excited to continue the series that we're going to be continuing tonight. But before I dive into the full introduction, we have a really sweet tradition here at Manny's. So I invite each of you to look to your neighbor. Hopefully that neighbor is someone you're meeting for the first time. And let's just take a couple of minutes just introducing ourselves, maybe how you heard about us and what brings you out tonight.
I'm Tom.
Yes, you too.
Yeah, I mean, kind of, I guess. I live in the neighborhood that walk by, and then I basically like bought tickets for everything. Oh, information. Obviously.
So I hope you all met someone that you are curious about. Whoa, okay. All right, so I hope everyone enjoyed that moment. We always think it's so important here at Manny's that we do everything we can to create community. And community for us can mean just connecting with the person sitting right next to you and finding out that you live not too far from each other. So tonight we are continuing our series, What We Learned, where we reflect on the last 18 months. I don't need to tell you what happened, you already know. And we have reached out and heard from a variety of city leaders about how they dealt with this time and what it's teaching them and how it's impacting their vision forward. And so tonight, I'm really looking forward to this. Who had on their bingo card being excited about public health? Here we go. Tonight, Manny will be speaking with the director of the San Francisco Department of Public Health, Grant Colfax. Probably one of the most important public servants that we have had for the last 18 months or so. So please sit back. We will of course have a period for Q&A. So if you have questions, please have them ready. As always, a reminder, thank you all so much for being so cooperative with regard to the vaccine card checks. I think we've had no problems. So San Francisco's been great. We really appreciate that. Yes. So of course, remember, if you are not actively drinking or eating, keep your masks up and just sit back and get ready for a great conversation. Thank you all so much.
Thank you.
Thank you, Precious. And now happy to invite the Director of the Department of Public Health, Grant Colfax, to the baby stage. Not the most impressive stage in the world, but in the world. Hi. Hi. We are dressed differently right now. I'm just gonna acknowledge that.
Diversity makes us stronger.
Diversity makes us stronger. I had lunch today. Yeah, I had lunch today with Precious of a woman who's running for Senate in North Carolina. And I didn't think when I was getting ready that I forgot about that. And so she came in full suit regalia, and I'm like, in Provincetown chic right now. So I'm sorry, not sorry. It was lovely. It's wonderful, vegetarian. First of all, thanks for doing this. I know the pandemic is not over and your job is still very difficult, so to take some time tonight to be in conversation with us means a lot. So thank you, Grant. I really appreciate it. Girl. I kind of wanted to start with your personal experience. I know you've been asked this a lot, but because it's such an extreme thing to be in a position of leadership during. But I want to kind of start with asking you about the weight on your shoulders over the last 18 months. I mean, how do you feel like you've been bearing it? And what toll has it taken on you?
I think that what's been remarkable about 18 months is how unprecedented it has been. And when I think about the early days of, watching what was happening in Wuhan, and it was sort of in the back of, not in the back, not very far back in my mind, it's because I've obviously been in public health for a long time. We always knew there was a possibility of a major pandemic hitting, and having really come during the age of HIV and AIDS at the worst times in the United States, I mean, that was very fundamental in my own personal and professional development. And then there was H1N1 and Ebola, both of which have caused serious illness, but has not obviously gotten to the level that COVID did. So I think it was just this dawning as I saw the hospitalizations in China and watching what was happening, that this is very much a possibility, plausible, possible, probable to actually be on us. And there's a combination of really focusing on following the data, science, and facts, while also realizing what a toll the pandemic was going to take. So sort of the focus on ensuring there was empathy for the public, the community, and also myself in terms of thinking of how we were going to get through this together. And I think that tension was just something to keep checking in on during these past 18 months. I mean, the focus on everything that we did together has really helped me, has strengthened me and inspired me. And then there are also times where I think we all have moments where we take a break, walk out of the room, whether it's a Zoom room or a room full of people, and just take a breath and realize that the human spirit is very strong, and that something that looks like we're not going to be able to manage it immediately, there's a way to do it, and it's really the collective consciousness that comes together on this. And that's what I think really we saw happen in San Francisco.
Thank you for that. Everyone's experience with this was different. And if you don't mind holding your mic closer to your mouth.
Okay.
Just for the Zoom, for folks who are tuning in on Zoom, it has been an endurance play, right? I mean, we all remember when the shelter-in-place order came down, it was going to be 2 weeks, and we were like, okay, we got like a 2-week, experience, and then we'll be back to normal, and we're almost at 2 years later, or we're coming up on it from when it first came about. You mentioned there have been moments where all of us have had to just kind of leave the room, take a breath, and just like get through whatever that moment is. Can you tell me like one of those moments for you, something that was going on where you had to take that breath, you had to take a walk? Because I feel like that's something we all kind of had to deal with at one point or another over the year and a half. What was going on?
Well, I'll get to it's not sort of, it's a very operational issue, but
Right.
I think that, there are crazy moments here, right? Where, this pandemic has taught me, and I think taught many of us, to be flexible and resilient, right? And then there's also the moments where it gradually became apparent that the federal side was not coming to assistance of local jurisdictions, right? And we were having, even now seem like crazy discussions about how we're going to reuse face shields, right? So I'm talking to the healthcare systems like, do we have enough face shields? Do we have enough masks? And at one moment I was on a call with other city operations people, and we were actually trying to figure out how to get to a warehouse of masks in a Midwestern state, and figuring out how to fly potentially a pilot in to purchase the mask. And I just took a step back and went, we're in the United States, it's 2020, we have a pandemic, and we have all these people, and trying to figure out how we're going to potentially send a check to get masks from a warehouse in the Midwest before another jurisdiction, we're competing with other jurisdictions. It was just such a moment for me to think, this is actually happening. And it seems so completely out of place compared to, what our usual norms are. And, luckily we did well, we got masks. I mean, that still did not happen, but it was just these moments where you're thinking, we're dealing with this global pandemic. We're concerned about the healthcare system, and in some ways we don't even have the basics because of our supply chains and because at that time, the lack of a federal response. And this is what, local jurisdictions across the country, my counterparts, I mean, the Bay Area, we were in relatively good shape, but so many local jurisdictions were left like, okay, go figure it out. I mean, another good moment where I had to walk out of my office room at the moment was when we were one of the first sites to do the CDC testing. I mean, again, really early on, like getting a COVID test, it was a massive undertaking, and we were one of the first labs in the United States that was chosen to do it. And walking out of the room when we realized like these tests are not working. And that was like
why weren't they working?
Because the CDC hadn't done their due diligence.
I forgot about that.
Yeah, no, exactly. That's why I got it like right. Yeah, my husband says you got to write this stuff down because you're not going to remember it.
Did you?
I was kind of busy.
There's so much to talk about with this. It's funny because I'm trying to figure out how much I want to go back and re-experience the last year and a half. Obviously, compared to most folks' experience for me, it was quite privileged. I own my own business. I was able to move my events online. But even so, like you bringing up some of the early days of the pandemic, I have to like almost reach back into my like head and heart to be like, what were those moments like? But I do want to touch on coordination. You have 8,000 employees, something like that, DPH, and then there's all these other city employees, and you're coordinating, like you said, with other Bay Area officials. Help me understand the kind of operational side of, you decide that people need to do X, right? That's a decision that you end up making with, in consultation. How did the wheels turn so that all the different departments were acting together and that message got distributed effectively to San Francisco?
Well, I think one thing, I'll start with the department first and then sort of work out to the broader context. But I think one big thing that the department has, which is really important, is the linkage between the sort of historically the public health side and the clinical delivery side, right? So we're somewhat unique in the health system, in the public health side of the house, where we have Zuckerberg San Francisco Hospital, we have Laguna Honda Hospital, we have 14 clinics, we have a very extensive network of care, in addition to the more traditional public health functions. And the fact that they were all under one department, I think it really gave us a leg up into being able to coordinate. So, compared to even nearby counties, the public health director is not connected to the healthcare delivery system nearly to the degree that, or doesn't have authority over it. So I think that's huge. I think that in this case, because we were a city and a county, that also really helped because it was a much more unified system. And then I think the other thing that was really pivotal, and this is, under Mayor Breed's direction and leadership, calling the city departments to come together, declaring a state of emergency, really broke down the historic silos of the, different departments, the bureaucracy of different departments, and we got it done.
Was that like a daily call with all the departments?
There were. I mean, at one point we were doing daily calls with all the key departments, and on exactly where we were and what we were doing. And I mean, obviously public health was there, but there were a number of other key departments going forward, and that created the ecosystem of our response to the pandemic, which set us up with regard to the shelter-in-place order, pushing that out. Then with regard to scaling up testing, I mean, we made a very strong commitment early on to get as much testing out as we could. And then that translated into, our vaccination prep. The other key components, I think, is we have a very strong relationship with other healthcare partners in the city. So the academic partnership with UCSF, many people in the health department trained at UCSF. There's, the general has a combination of UCSF faculty and DPH faculty. So that really allowed us to respond very quickly to and make early discoveries and respond very quickly to the latest in the pandemic. So literally the people writing the papers that were seminal papers on the COVID-19, many of them were, working with us on even daily and weekly calls. Mm-hmm. And then we have very strong partners in Kaiser and Southern Dignity that really wanted to come together to do the right thing in our healthcare system. Because remember, again, early on with these surges, one of the most concerning things is we were going to overwhelm our healthcare system, right? Overwhelm our healthcare system. We weren't going to have enough people to take care of people. And that was, something that we really moved on very quickly, assessed, had a whole surge plan, and that was really key. And I still think one of the most inspiring moments that I'll never forget is realizing that, our first surge was beaten back. And what that meant about what San Francisco did, and that we showed it could be done, that was a moment.
Yeah, it's hard to understand what the impact of all the lives that were saved really is. And so a moment of thanks and gratitude to you and all the doctors. I should mention that one of my best friends in the city is sitting in the front row, and she actually moved here. When did you move here?
July.
2020. And she's an ER doctor, and she's been at General the whole time, pretty much.
Thank you.
So I got a front seat to what it was like being an ER doctor throughout it. So thank you, Becca, also.
It's fantastic.
So about those decisions, how did you? So clearly, the weight of the lives saved is first and foremost. What matrix did you use to weigh the potential life-saving, effect of these decisions would be versus all the other impacts that it might have on the economy, jobs, the politics of it? Like, how are you weighing all those things?
Well, I think that's, when looking at the data, and there was really, I think that the data really showed that there was no jurisdiction that said, oh, we reacted too strongly and too quickly early on, and now we're disappointed that we did too much, right? So I think that it was clear, and I think it was also clear that, there are very real and serious consequences, health-wise, socioeconomically, to some of the things that we had to do. But I think the counter piece is that just letting things go as they would have been far worse, right? And there's a lot of studies around this that, well, the places where public health measures were put into place, what many people would consider aggressive public health measures put in place, that those actually, those economies and those, the other peripheral effects were not as negative as when there were not those aggressive health measures put in place. So I think that's something that's really lost in the conversation, and it's really harmful to our thinking about how there's now in a lot of the narrative around the COVID pandemic, there's sort of this dichotomy, oh, there's public health, and then there's like the economic engine, right? And that's actually a false dichotomy if you actually look at the literature. And I think that's just a really important thing to emphasize. So we were always really focused on making sure that didn't get decoupled.
Got it. This is maybe a little bit of a strange question, but I'd be interested to just hear. You ran the Department of Public Health. You're this major city leader, and then there's all this stuff happening on the ground, and the decisions that your department were making and with you as its leader were so important. Were you able, over the course of the last 18 months, to walk the COVID wing in the hospitals, or talk to some of the folks whose family members were saved because of the measures, and really, obviously not touch and feel, but in a way, experience, how on the ground what the weight of the decisions that.
Well, I'm really glad you asked that question, because we focus a lot on the hospital and the healthcare, people in the hospitals, which I think was key, and they were putting their life on the lines every day. I also think where I learned the most with HIV and AIDS, and where I learned the most with COVID-19 is coming down to the mission, working, engaging, learning from the Latino Task Force, for instance, other community groups. Here's what we're dealing with, here's what needs to be done. We understand, what's happening in the hospital, but you're not going to have people go get tested if they don't have support for their lives, if they don't have food, if they don't have behavioral health support, if they don't have a place to go stay. So I think that was so key. The hospital part was a major component, but also building this ecosystem of support. So we had isolation quarantine hotels, we had hundreds of people avail themselves. We had shelter in place places for people who were experiencing homelessness. I mean, another moment that I won't forget is when I got the call about one of our shelters and our first major outbreak in that shelter. And there were, caseworkers and community members working there overnight to figure out how are we going to take care of people. And that's where that really helped inform how we manage the shelter population. Talking to the people who are working in the jail and congregates, in that congregate setting. So there was a lot of community engagement and leadership. And again, I think that's what made San Francisco so successful in our response, is that it was really the people who were tangibly engaged on the ground that helped inform our public health efforts. And again, I think that's a lot of legacy from HIV/AIDS, where the bureaucracy, the system does what it does, but it has to be pulled back to what's really happening and be responsive. And I think the thing that I really appreciated was people advocating for us to be responsive to the needs, and not to tell people what was needed, but to be humbled and to remain humble, occasionally to be humbled, and to really recognize that we have to be resilient, flexible, and responsive to the community in this pandemic, and we always have to hold that going forward. Right?
Totally. And as you speak, Grant, I'm reminded of how impressed I've been around our city's response. And I think all it took was some conversations with folks in other cities where like they couldn't get a COVID test, or they totally boxed the vaccine rollout, or the city leaders or city officials were like doing the exact opposite and prioritizing in order to gain points with Trump or whatever, making public statements that put people's lives in danger. So I felt very lucky to be in San Francisco over the last year and a half, and I'm reminded of that hearing from you. How prepped are we for future pandemics? I mean, you were here and you worked in the Department of Public Health, the AIDS pandemic, and you talked about how that in some ways gave us some learnings for this pandemic. Do you feel like we're a lot more prepared now for the next one, or are we still not in that process of learning quite yet?
Well, we're still in this one. Just to emphasize that.
I don't know what you're talking about.
Well, I think there's a question of sort of what level we're talking about, right? Because locally, I'm cautiously optimistic about where we are right now. I think if you look at the trajectory, it's generally one of, it's positive. Yes, there's bumps and, there's surges and swells, and we have to adjust. And, but if you look at compared to where we were last year at this time, we're in a much better place. And I think that the muscle memory of how to respond to this, I think will help us figure out what the new normal looks like. I think COVID-19 is going to be endemic in our country and the world now. It's not going to go away. So I think we have to figure out what does living with COVID-19 mean, and what does that look like going forward. I don't think any of us fully know, but I think it's the thing that we have to really figure out together. And at the same time, this week there's an average of 2,000 Americans dying every day of COVID-19 in this country. So I'm like, how is that normalized? I think for some people it is actually like, oh, it's in the background, right? So, I think it's amazing how resilient and adaptive humans can be, but also like, how does this get to be a place? So I think right now we still have a lot of work to do nationally and obviously internationally. I hope that the lessons learned from this pandemic will inform our next response. But if we were talking, if you had told me, I don't know, before the vaccines were like, how soon? I was wrong. I thought we weren't going to get a vaccine for, at least 2 years. And I told my mom, you're going to have to shelter in place. She's in her 80s, like, we're not going to get it back. She's like, oh my God. It's like, well, it's been, so the point is, if you told me that we would have.
You told your mom that?
Well,
you were trying to be realistic.
Protected. Yeah. But anyway, she's really happy she has the vaccine.
Yes.
But I think that the point is that if you told me we were going to. If you'd asked me, would we have vaccines that were, 95% effective in preventing hospitalization and death, And then we've had them for a number of months and, 55% of Americans have received the vaccine at this point. I mean, would you believe that? It's kind of astounding to me. So I think we have the tools to, bring these numbers so far down, but we're not utilizing them. So I think we're better prepared with the tools, but the question, tools that are, vaccine in the freezer is not
Right.
helping.
Are you surprised? Are you like, so San Francisco and then the country, are you surprised at vaccine adoption pleasantly, or are you concerned? Like, if you had asked you like, hey, we're gonna get the vaccine, in March or whatever, March or April, do you feel like we're doing about as well as we thought we would be doing, or not as well, or better?
Well, I think right now we're doing well. I think we always knew that there was gonna be the big surge of uptake, right? Which was very positive in San Francisco. We hit thousands of vaccines and going to arms. And then the question was, what's the tail gonna look like? And we're at 82% of San Franciscans who are eligible for vaccine fully vaccinated. So that's great. And the teams, and we're listening, we're in communities. We have nearly 100 sites in San Francisco where you can get vaccinated. Many San Franciscans are within 5 to 10 minutes walk of the vaccine site. Almost all are within a 5 to 10 minute drive. We have a drop in. We'll bring the vaccine to you if you have 5 or more people ready to get vaccinated with a call. So I mean, we're doing everything we can, and I think our numbers are very, very good compared to almost any other jurisdiction. I mean, if we were a country, we'd be second only to Malta in terms of our vaccine uptake. And the next big thing is going to be 5 to 11-year-olds, and we're excited about. We think that those will be authorized at the end of October. So I think we're doing really well, with the caveat that we still have hundreds of San Franciscans who have chosen not to get vaccinated.
Mm-hmm. How do you get the I feel like the people who are resistant, who haven't gotten it yet, are either somehow missed the boat and just need a little helping hand, or they will not get it because it's firmly as a part of their identity. So it seems like we're doing everything for that first. I mean, we're making it. We can't make it any easier than it is now. I mean, I think they were giving vaccines out at Folsom Street on Sunday.
Oh yeah, I thought we're everywhere.
And I was like, okay, yeah, get your vaccine here. Why not? But the people like the NBA player who's potentially gonna, rather lose his job and millions of dollars to get a vaccine, feels like that's such a strongly held belief that how do you get that population vaccinated, or do you not?
Well, I think it's a combination of, again, making sure that there are a lot of opportunities to have conversations with people about the vaccine. I mean, obviously, people, will make an individual choice, and also what are the consequences of not getting vaccinated, right? Which we're also seeing with mandates and requirements like coming in here to meet. So I think it's that, and I also think it's acknowledging that in communities of color, the systemic inequalities, the history of racism in medicine, the history of exploitation and racism in research has consequences for whether people are trusting the systems. And that really means that we need to do everything we can to be humble and listen, engage, and be available. And I think one of the things that we're still learning is how many touches, how many conversations, what are the policies that will encourage people to get vaccinated. Right now in San Francisco, the group least likely to be vaccinated for COVID-19 are people who identify as white, non-Latino.
The people who are least likely to want to get vaccinated are what?
To have at least, So, and the group in age, it's the 25 to 34-year-olds.
I see.
So,
Have you thought about paying people, give them $100?
So there are programs that
No, seriously, if you're
Yeah.
25, a couple $100.
So there are programs, I mean, there are programs not DPH specific, but there are programs that are reimbursing people.
Great. Okay, so I know you're not gonna like this question, but I'm gonna ask it anyway. I was at the Fillmore last night, and to get to see Lucy Dacus, amazing singer-songwriter, folk singer, fabulous, love her, you should see her sometime. Maybe with your mom, now that she's vaccinated. Everyone was vaccinated to go in there, and you had to make sure it was your vaccine because your ID was checked. And then you go to this, which, we were kind of told that if you get vaccinated, that was your ticket to normalcy. And you go in there and everyone was masked. And so there does feel like there's this feeling of it's performative almost. It's like we're all here vaccinated. Sure, maybe a couple of us could potentially get a breakthrough case. But even if we got a breakthrough case, like there's a 95% chance that we're not going to be hospitalized or die. So really there's like a tiny chance someone can get a breakthrough case, and then a tiny chance that person could get really sick. And yet we're all here not living a normal life. We're kind of living a normal life, but we're scared or we're back or we're masked. So like, help me understand why I'm wrong. Like why it's not performative, and actually it's super important that even though we're basically every space in San Francisco, you have to be vaccinated to enter it, we still have to wear masks.
Well, I think it's not an either or question, right? So I go back to the trajectory of where we were compared to where we are now. And I also think something that needs to be emphasized is where we are now with Delta. And Delta is like a complete, it's COVID on steroids, right? So, and I think we had that little period where we were still dealing with, variants that were not as contagious as Delta. And we had that moment where people are like, oh, things are, we're gonna be able to take the mask off forever, and as long as you're vaccinated, everything will be fine.
I remember that moment fancifully.
Yeah. So I think that, what we have to figure out going forward, and we're collectively, because this is not just a DPH rating, this is us figuring out as a community and what does our culture look like going forward, is a combination of high vaccination rates that we know are going to be highly protective against a death, while continuing to protect the most vulnerable. And I think I've learned to be humble about predicting the future, but I think given where things are, and we did have a big bump in cases, including among fully vaccinated people this August, right? There was quite a peak. But I think as things continue to go down, and by the way, today we're at about 10 per 100,000, 10 cases per 100,000 people. That's half the state average, and as I think the state is doing about as well as any other place in the United States.
Isn't it the only state that's now not on the CDC's high velocity situation list?
Yeah.
Which is
So I think that we will, with the 5 to 11-year-olds getting that's another big piece, right? Because there are a lot of people who kids were not eligible for vaccines, so we really wanted to focus on getting kids back into in-school learning, in-person learning, because that is such a key intervention. That is such a major issue, such an equity issue, right? And also, health and wellness issue. But as we get 5 to 11-year-olds vaccinated, and not to be specific on any timeline, but I would expect we'd see a gradual relaxation of indoor masking rules. Thinking about things like, where is the greatest risk? Who is the greatest risk? What are the numbers of people gathering together? What is the size of the event? And so I think that's going to be a stepwise fashion. And then I think we're going to have to figure out as we look at endemic COVID, how do we monitor that high vaccination rates, boosters going into arms, continue to focus on those primary vaccinations that are so important, and the hospitalization numbers, and of course the deaths as well. But just to give people some clear metrics here, right now our hospitalization rate among unvaccinated is 7 times higher than fully vaccinated. We've had a total of 77 fully vaccinated people hospitalized in San Francisco. So these vaccines they're incredible medicine.
I know you want to get into timelines, but if kids are only going to be able to get vaccinated at the end of October, it just feels like, so is that what we're waiting for? Are we waiting to make sure that the kids are all vaccinated and then we can know that it's safe? Because kids have there been, actually, I don't know, how many people 5 to 11 have gotten COVID and had to be hospitalized?
Yeah, very few kids have had to be hospitalized in the city. So that's just true for COVID. Thankfully our numbers have been extremely low.
I know outbreaks in schools, right?
Well, we've had great success with the schools. We have over 52,000 kids in the public school system, over 10,000 staff, and we've had relatively few infections and less than 5 outbreaks. And I think somewhere around 10 in documented in-class transmissions, so.
That's amazing.
Very low rates, and we've been working very hard with the Unified School District. But I think what we also want to make sure is, the vaccines are obviously tremendous in preventing hospitalization and death. They also decrease transmission rates, right? But I think it's a matter of looking at a combination of our vaccine rates, the populations that are eligible for vaccine, our hospitalization numbers, and the trend in cases per 100,000. I mean, I think masks are going to be with us for the foreseeable future in some capacity, right? So I think the day that, say, for instance, at our Laguna Honda Hospital, like skilled nursing facilities, high-risk congregate settings, masks are gonna, as far as I can tell, be there for a while. And I think from very low-risk settings to settings like those, there will be a gradation of potentially how masks they come off, and then depending on what happens, masks may have to go back on. So I think we've learned this issue of resilience and flexibility in terms of how to do this. And I know it's really challenging. I think it's challenging for us psychologically, also for, I can imagine that for business owners like yourself, it can be a real challenge. And I think it's something that we want to work with everybody on.
Yeah, I think at this point, and if folks have thoughts during Q&A, feel free to share them. I feel like at this point, it is more psychological, just like emotional. It's just been such a long. We've had to flex and come toward and change for the right reasons, and super proud of them. I think what I'm just seeing out there in the community is just being tired.
Yeah.
And also just tired of the unknown of like everything you're saying makes total sense, but not being able to plan for, what a future looks like where I don't have to worry about someone coughing in a room, or I don't have to not be able to go into a shop because I forgot my mask in my, my bike or whatever. I think that not knowing it's grinding down on me for sure. I'm sure others as well. So what advice would you give to people who are like, I get it, I'm proud of San Francisco, I'm so glad and proud to be here, and also I'm tired of all this.
Well, I think it's maybe taking those whatever minutes you need to take a few deep breaths and do your risk assessment. I mean, I think that's you're asking like, when are things going to be safe? And I would go back to the HIV, training that I had and applied to my own life. Like, it's not like an absolute yes or no, right? There are things that are safer, right? Where if obviously we want everyone to follow the health orders and guidelines and recommendations, but within that context, I think there will be likely increasing flexibility, right? So I think that people have to come to some assessment of what they're comfortable doing, again, within the context of public health mandates and orders that may be gradually relaxed, and then they may have to be applied, if we get, for instance, another variant or something like that. So I think it's this new normal that we're going to have to learn to live with.
I only have a couple more questions for you.
Absolutely.
The first one is about other public health crises or priorities that may have taken, not a back seat, but had to, just for the nature of the emergency, either have less focus or less staff time. Were there any other public health issues that you felt like weren't able to get the attention they needed because there was this focus on COVID?
Yeah,
super long?
I think I'm just thinking of, this pandemic has had significant immeasurable detrimental effects on health and wellness outside sort of COVID versus COVID, directly COVID attributable deaths. So I think if we just think about what the healthcare systems had to do in terms of pulling, hundreds of staff, in some cases thousands of staff to work on COVID, we've seen, screening for chronic diseases drop dramatically. We've seen the impact on behavioral health, profound impacts on behavioral health. We just issued, our annual HIV report for the city, and things appear to be continuing to improve, but we had a great drop in HIV testing and screening and other sexually transmitted disease testing. as you know, I mean, a priority of the health department, a priority of the mayor, a priority of San Francisco is our behavioral health system. And, you know, we had a lot of.
Sorry to interrupt, when you say behavioral health system, what exactly do you mean? Do you mean like what people see as folks suffering from mental health issues on the street, or are you thinking about not street homelessness, mental health stuff, but like a lot of people in San Francisco dealing with their own mental health issues in their private life who do have homes, or when you say that, what exactly?
I mean, I think it's a combination of factors. Our focus in the health department has been on, you know, people who generally don't have healthcare coverage, you know, other than public coverage, and obviously, you know, the conditions on the street and serving the home and the people are experiencing homelessness. And I think that the focus on everything that we needed to do with COVID, which by the way had major behavioral health components as well, like our shelter in place hotels, where we had behavioral health staff, social workers, clinical nurses at those hotels, supporting people in those hotels. But that also took a huge amount of effort, and we were not able to prioritize some of the things that we were planning to do for the 18 months. But things are moving forward. You know, we're starting the first sobering center in the city. We just announced that today. Yeah, with Supervisor Weiner and Mandelman and of course Mayor Breed. So I think we're now building on you know, lessons learned not only from the pandemic, but the things we're planning to apply. So I think there were a lot of consequences of the COVID-19 pandemic that we're going to be dealing with for a long time, both physical and mental. Overdose. I mean, we had 712 overdose deaths last year in San Francisco. It's another pandemic that, you know, we have to, and this is, you know, it's a huge issue in San Francisco. It's a huge issue across the country. And before COVID, I mean, we were seeing life expectancy of Americans drop. The life expectancy peaked in 2014, 79 years of age. It's been dropping since then. And a lot of that was attributable pre-COVID to the opiate crisis, particularly on fentanyl. So how do we bring in, how do we increase access to care, lower barriers to care, innovate and coordinate? And those are the things that we're doing. A safe injection site, safe consumption site, priority of the mayor, priority of the health department. Hoping that bill does move through and is signed by the governor. So I'm optimistic that many of the lessons learned from COVID-19 in terms of coordination about how to break down bureaucracy, about really responding to the needs of people, will help us do even better, including in behavioral health and our healthcare delivery systems overall.
I feel like we could have multiple long conversations just about the two things we talked about. The only follow-up question I'm going to ask is, because it begs being asked, which is, we declared a state of emergency for COVID. More people have died from drug overdoses in San Francisco than COVID in the last year. Why shouldn't we have a state of emergency because of the fentanyl overdose?
Yeah, I think we're really focusing on taking action right now. I think that's what we're doing right now. I mean, I think that declaring a state of emergency, I mean,
doesn't really do anything.
This is like we are on this, and we're using the tools that we have at our disposal. Mental health SF is the investments that the mayor and the board of supervisors are making. We brought in new behavioral leadership. We're building out the mayor's, you know, we're focusing on developing 400 more treatment beds, investing in 400 more treatment beds. We have our new behavioral health director, Dr. Hillary Cummins, came in, and within, I don't know, very short after time of starting, has started this street outreach overdose program, where we're actually able to prioritize people who have had an overdose to help them prevent a fatal overdose going forward. So using data to focus on the people most at risk in a more organized and structured way. And so how do we improve and work? You know, so many of the people in our city are touched by healthcare providers or health or social works or, you know, services in some way. I think the question is, how do we make sure they're receiving the right services at the right time and that those services are coordinated?
Okay, my last question to you is, we've seen, and I bet if you and I were talking 2 years ago and I told you that public health experts and directors would become somewhat of a celebrity in their own right, and that Anthony Fauci would be one of the best known men in America. Are you ready to just be a bureaucrat again and not, you know, be at press conferences every other day and in the news and have TV cameras following you?
I'm very ready.
Okay, me too. let's get to some audience questions. We have time for a few. All right, go ahead.
Hi, I first want to say thank you so much for being our hero. I'm a San Franciscan, and you're not the only person, but you made me feel safe during this very scary time. And I really want to thank you for that. And then I want to kind of move to another question. I've been a head of a department before, but a department not as large as yours. And I would hate to have this appear in the Chronicle. They said that the police had some 200 people that refused to be vaccinated, but 300 people in the Department of Public Health that refused to be vaccinated. And as a department head, that would scare me to death. So I don't even know if it's true. How do you deal with that?
Well, first of all, thank you for your earlier comments. And I mean, I think it's one of those things that we're looking to support people in getting all the information they need to hopefully make a decision to get vaccinated. I think that the literature in psychology of people coming to a new decision about their health, it's really about making sure that you're accessible, that you have the conversations, that things are done in a understanding and non-judgmental way. And so what we're doing about it is ensuring that within the city, and including within the health department, that there are webinars, Zoom, Teams, whatever, with clinicians, other people to talk to employees who have questions about, and concerns about the vaccines. And we keep doing that and keep doing that. We've seen the numbers go up over the last couple of weeks. I don't know if people saw what happened in New York. They went from 84% of their healthcare system personnel vaccinated to 92% within about 36 hours of the mandate kicking in. So, I don't know whether that will happen here, but we're continuing to do everything we can to support people in getting vaccinated in a way that hopefully meets them where they are and also makes them realize what the consequences will be of not getting vaccinated, right? It's a personal decision, but that personal decision also has consequences, whether you decide to get vaccinated or not. I think the hard part is there's just so much mythology out there about vaccines, and I think that's something that is really challenging to address in a way that people who have spent years training in medicine and public health feel like their work and their lives have been devoted to finding things like these vaccines, and then to have so much misinformation out there about it is at times disheartening.
All right, over here.
Yes, do you think measures such as the curfew and having to have food with a beer or closing the beaches might call and have people question needful measures?
I'm sorry, needful?
Yeah, so the question was, do you think that some of the policies that came about with the pandemic, like making people eat food with drinks, there was a curfew, though I think the curfew was about the protests, not, well, businesses did have to close at 10 actually, so there was a business curfew.
Yeah.
And then closing the beaches, whether that may have called into question, I think maybe like the validity of certain, maybe you had gone too far, or whether it was really were you like, was it a nanny state where you were like, you're making me eat a chip with my beer because somehow that's supposed to prevent COVID. Is that what you're asking?
Right, and thus having people question the needful measures, because obviously there were measures that needed to take place.
Yeah.
And that-
Yeah, and then how needful those were.
Yeah, I think it's an important question. I think we're always trying to balance not going overboard, but also realizing we had to act on our best judgment and do it quickly because this virus could get out of control so quickly. So I guess if we felt that there were times where we could draw back some of the things that that were the most sort of restrictive and that people that were the most restrictive, that we try to pull those back as quickly as possible. So I think it was just a matter of learning and engaging and watching the data. But I think that there were real reasons for some of the decisions that were made, good reasons in terms of some of the evidence around, intoxication, people that be, potentially less careful, large numbers of people gathering. Remember, I mean, now we're pretty clear that the outside activities are a lot less risky than the indoor activities, by magnitudes. That wasn't totally clear for a long time. So I think we tried to adjust as quickly as possible when the information came out and revised our findings accordingly. Our policies accordingly. But it was always this balance of, how quickly do you act in terms of the best judgment and the data and things that appear to make sense at the time, and then how quickly do you potentially pull back or go to different interventions that the evidence shows are effective. I mean, the masking issue, right? I mean, remember early on, people are like, oh, people don't need to mask. I think that's one place where in retrospect, and given all the science that we know now, masking up as quickly as possible was clearly, would have been the right thing to do, but we just didn't have the data. In many places, we didn't have the mask.
You have a question over here?
Yes, thank you so much for being here, and this is great, the accessibility. The big problem I find is that so many people who are not on board with this don't have access to talk to you or be in a situation where they can ask the questions and maybe then you can get the information to them. So I was just wondering, not on Zoom and not on, can they access?
Are you talking about people who are don't want to get vaccinated?
Yeah,
Okay.
or just have
Like-
more questions about things, because on
Yeah.
Zoom, it's very in-person.
Yeah. How is the department doing that liaising to folks who might be
Yeah.
concerned or questions or getting the wrong information?
Yeah, I mean, we've done hundreds of outreach work with community members, conversations, going to vaccine sites, having the outdoor or in some cases indoor conversations with people. I mean, it's many people across the department, many clinicians. So I think that those conversations are going on across the city every day. And I really emphasize that we need to make sure that we're there for people. Just as I was saying about with the city staff, right? We're there and having those conversations. Yes, I think on the Zoom and Teams, it loses something, but at the same time, in some ways, you get a bigger audience in some of those cases.
You don't get all of this, like,
No. Right. But we're out there and doing the education and working with community. And we've also, having the bureaucrats talk about this is not often the most effective thing. Like, I think that we're also looking at the information that having a trusted friend or a family member or a grandmother, those people are the social networks that people have that are often more trusted messengers than the people that run departments. So I think you can't make a generalization. So I think it's really about trying to ensure that as many people are out there having these conversations as possible, so that when somebody's ready to listen, the person that they're ready to listen to is there.
I want to acknowledge, is anyone on Zoom that has a question or I just want to ask? In the meantime, I think we have time for like one or two more questions. Let's go over here.
Sure, I think that, thank you. COVID has highlighted for all of us that we can contribute to public health by staying home for the good of the community. I'm wondering, outside the context of COVID, are there things that we as the general public can do, like practical steps that would help with, the behavioral health issues?
Yeah, well, I think, thank you for the question. I really appreciate it. I think, with the behavioral health piece, recognizing that mental health, I mean, there's both mental health and substance abuse issues, wrapped up in that term, but approaching people with compassion and empathy, realizing that it's a chronic relapsing disease, I think is really important, because I think that and I understand the frustration that people have around, why are people acting this way on the street or, in a certain setting. So coming out with compassion and empathy, and then there are actually a lot of, there are trainings around what's called mental health first aid that you can take online about how to approach somebody, how to, or if someone is engaging with you in a way that is uncomfortable and you think it's because of mental health or substance use related issue, how to manage that. So I think there's a lot that we can do in teaching ourselves how to become, how to apply mental health, behavioral health first aid in our community. So I'd encourage you to look at that.
Okay, I know I said I'd take more questions, but actually I promised Dr. Colfax I'd get him out of here on time, and it is 7:30. And we all can acknowledge and agree that this time is very precious, and he's, I'm sure, a very long workday, multiple press conferences. So first, a round of applause for Dr. Colfax. Very quickly, we have a couple upcoming events that I'll tell you about tomorrow. We actually have a really cool event on the future of Glide Church. There's been a lot of changes with Glide. It's a very important institution in the city. Next week, we have some fun community events that I want to tell you about. On Tuesday, we're actually going to do some letter writing. Gratitude letters, so letters to loved ones, family, friends, just to say you love them, you're thankful for them. On Thursday, we have an event, a community conversation, SF's next big idea. So come with a big, bold idea from San Francisco and you can present it and talk about it. And then on Friday night, we have the first in our series of San Francisco Appreciation Movie Nights. So we'll be watching Mrs. Doubtfire here all together. They're all movies that center San Francisco in some way. If you are interested in supporting our work, you can become a Manny sponsor. It's $36 a month or more if you are comfortable. There's QR codes on the pillars, or you can find me afterwards. You'll also get an email with the link if you'd like to do it privately. Really appreciate your love and support. I want to thank Precious Green, our director of programming, and Ramsey Sullivan, Head of Operations, and Tomasky Spelson for having research for tonight's event. I want to thank my friend Becca for being the PR doctor. And anything else? Y'all stay safe out there. Like, I know it's been really hard. I know it's been a really long, tiring journey, but take us home.
I have a movie recommendation.
Ooh, what is it?
1978, 1979 remake of Invasion of the Body Snatchers.
Oh.
Donald Sutherland, Brooke Adams. He plays an epidemiologist in San Francisco, who the film is inside the public health building.
Oh, wow.
Like on the third floor of my office.
What?
And they're dealing with an outbreak.
And it's Invasion of the Body Snatchers.
Yes, I mean, it's not a great movie, but it's San Francisco in the 70s.
Okay, well, I might, if we do it, I'm gonna invite you to it, all right?
All right.
Thanks very much. You guys can exit through the right-hand door and, have a good evening. Thanks so much.
Manny, Dr. Colfax, me and Rep to get a photo of the two of you together. I'm great, how are you? It's been a long time since the CCC.
Yeah.
But Manny's been doing great things here.
I know. Good. Perfect.
You want me to-
Thanks, Greg. Appreciate it. Yeah. How about there? I mean, I think we're all.
Oh.
But, another
Yeah, I just didn't know what to expect.
No, totally. I didn't know what was going on.
All right.
They were like,
I mean, that was my question, like, how do you go from just being to basically having a rhythm section you did not ask for? Everybody gets. So, I'm just.
Okay.
Okay. I also want to thank you for responding with science. And ironically, we had the bathhouse legislation removed the week we had shelter in place. I was like, oh my God. The universe had those legislations were based on fear. And so responding to science. Okay, like you said, you made it. I appreciate it. Thank you so much.
I just want to thank you.
Oh, thank you.
And just really appreciate what everyone. I did have a couple questions, I know you gotta go.
Yeah.
But I just, how has it been going from